So next is urological trauma. It's V49. 35-year-old man falls over while drunk and attends the A&E. He was referred to you with microscopic hematuria. What investigation would you request? This would be determined by the history and mechanism of injury and his signs. He requires a careful examination of abdomen, thoracic area. Tenderness here may be result of underlying bladder injury. Mechanism is minor with no abnormal signs like bruising, ecchymosis in the flank, tachycardia, tension. Then no investigation needed and the patient can be discharged without follow-up. If there is a mechanism of injury, serious, a fallen from a height, assault, and adverse signs of flank ecchymosis, hypotension less than 90 systolic or tachycardia, then after gestation I would request an urgent contrast CT to identify the grade of the injury. What clinical features would you suggest for renal injury? Loin bruising or swelling. It is important to document the location of any bruising, swelling, or internal examination. Macroscopic hematuria in adults. Hypertension less than 90 systolic and 12th rib fracture. If he had been kicked in the loin by a horse and presented with frank hematuria and tachycardia, how would you manage him? I would resuscitate him and request a 4-phase CT, pre-contrast, arterial phase, venous phase, and collecting system phase. These phases are important as they show enhancement, arterial leaks, urinoma, collecting system defects, which are all important for grading renal trauma. Can you describe the grading and its relevance in the renal trauma? So, American Association of Surgery for Trauma has 4 grades. A grade 1, contusion or non-expanding hematoma, subcapsular hematoma. Grade 2, non-expanding perineal hematoma, cortical laceration less than 1 centimeter deep without extravasation. Grade 3, cortical laceration more than 1 centimeter without urinary extravasation. And grade 4, laceration through cortic medullary junction into the collecting system, vascular segmental renal artery or vein injury with contained hematoma, or partial vessel laceration or vessel thrombosis. And grade 5, laceration, shattered kidney, vascular renal pedicle injuries or avulsion. Now, how would you manage this man if his CT urogram showed viable renal tissue with contrast enhancement and some minor urinary extravasation? This is a grade 3 injury. Admit, resuscitate, commence antibiotics to reduce risk of infection of urinoma. Prescribe bed rest for 2 days, 48 hours. Repeat imaging to ensure no expansion of hematoma or urinoma. If he spikes the temperature or drops his hemoglobin blood pressure, then repeat CT scan. If his urinoma is expanding, then it may need draining with stent placement. The patient will remain stable. He needs an outpatient urinogram in 3 months to look at arterial split kidney function. What are the complications of renal trauma? Delayed bleeding, post-traumatic hypertension and urinoma, and perirenal abscess. Late complications also include pseudoaneurysm, arteriovenous malformation, page kidney, renal insufficiency. Thank you.